This wasn't the most satisfying subject to cover in a video, but I believe in the case methodology, explaining things in clear and simple English for my viewers. Hi, Jerry here again with some relevant information about the skeletal muscle disease called inclusion body myositis, or IBM. This episode is aimed at IBMers who are looking for an answer to the question that pops up in our minds upon hearing the IBM diagnosis. That question is, how will having IBM affect the length of my life? I know, you've probably heard or read from multiple sources that IBM doesn't cause a premature death. They are probably correct if they look only at official documents from the government or death certificates. But how many local county coroners or physicians signing a death certificate would document that a head injury caused mortality was actually a consequence of an IBM fall, or that passing away from pneumonia sparked as a result of an IBM lung aspiration event from having dysphagia? While IBM is rarely officially recorded as a cause of death, it has to be recognized that many deaths in IBMers are related to complications of this disease. Let's start out by defining two terms, morbidity and mortality. I'm going to discuss these terms relative to inclusion body myositis. IBM morbidity refers to the number of people with inclusion body myositis within a certain defined population. IBM mortality refers to the proportion of deaths caused by inclusion body myositis in a certain defined population. The IBM morbidity rate is sometimes a strenuous number to analyze, whereas IBM and how it affects mortality rate is even more difficult to determine. One conclusion resulting from this study was the definition or accounting between those who had a fast-progressing IBM versus those considered having slow-progressing IBM. Almost 13% of the study subjects were identified as having fast-progressing IBM versus 77% of the people identified as in the slow-progressing category. Although both fast and slow-progressing IBM are very notable and serious, people with slow-progressing IBM notice change over a much greater time period and possibly never witness the full brunt of progression to skeletal muscles as experienced by those IBMers in the fast-progressing category. This recent study shows a varied morbidity rate that may surprise you. Australia resulted in having the highest IBM morbidity rate of any country surveyed. Breaking it down even further, Western Australia logged in equal to 14.9 per million people, and South Australia at an astonishing rate over 50 cases per million. In comparison, there were 10.7 IBM persons for each million population in the USA reported in the study. The identification between slow and fast progressing IBM helps explain the variances among patients with this disease. Keeping a log of your IBM progression, as I outlined in my IB myositis videos, numbers 5 and 6, using the IBM functional rating scale, may give you a fairly good indication whether your IBM is one of the 13% fast progressing or one of the 77% slow progressing. If you have IBM, I hope you are in the slow progressing category. The highest ranked feature of IBM considered being a contributor to death was oropharyngeal muscle dysfunction, which can lead to dysphagia and subsequently aspiration and/or pneumonia problems. 60% of the 734 patients in the recent study were reported to have experienced dysphagia or trouble swallowing. So my first word of caution is to pay close attention to what's happening in your throat area. Remember, smaller bites, chew your food well, then chew it some more. A specialist once stated, chew your food until it is the consistency of soup before attempting to swallow. Over half of the physicians involved in this study also agreed that patients experiencing falls had shortened lifespans, particularly older patients and cases where falls led to head injuries and possible secondary complications that can cause sepsis. Sepsis, also one of the top 3 contributors to IBM mortality, is caused by an immune system response triggered to an infection. Common locations for primary sepsis infections include lungs, brain, urinary tract, skin, and abdominal organs. But the cause of death on a certificate might only reference sepsis or infection as a reason for death, and would probably never note an IBM-related condition as the original cause for the sepsis infection. Broken bones, sepsis, and other secondary consequences of falling are why there has always been a "just do not fall" warning placed on the IBM community. We've probably all experienced several falls in our IBM journeys and might consider ourselves lucky to be able to talk about them. A serious head injury could result in becoming a mortality statistic, as might a simple infection from an open wound or necessary surgery resulting from a fall when having a disease such as IBM. Third on the list of conditions that contribute to a premature death statistic in IBM is cachexia, or generally being in a weakened or enfeebled state. IBMers in this cachexic state may just give up on the constant battle, again probably never documented as a cause of death. Newly diagnosed IBMers often ask how fast they will require certain equipment to maintain their mobility. The study concludes the mean reported time from diagnosis to a cane was 3.9 years, and the corresponding time to using a wheelchair or power chair was 10.5 years. However, several physicians surveyed found this question difficult to answer because of the variation in levels at the time of IBM diagnosis. On average, physicians said patients experienced symptoms for 4.5 years before the formal diagnosis was made, so that could conceivably lower the wheelchair power chair requirement time to around 6 years, or even less if you are in the fast progressing category. And a suggestion to use a cane or walker could come out as soon as the official diagnosis. Here's another term we can discuss: comorbidity. Comorbidity is defined as a person with more than one medical condition or disease process beyond the initial diagnosis. How many of us have more than one condition besides IBM that might contribute to becoming a higher risk of being an early mortality number? Diabetes, lupus, obesity are among the leaders of a long list of other conditions that result in comorbidity in folks with IBM. I am one of those comorbidity statistics. I was not only diagnosed with IBM in 2007 after a couple of years of unexplained weakness and falls, but was also found to have a low blood platelet count condition called ITP, or Idiopathic Thrombocytopenia Purpura. My ITP is caused by something prematurely eating the platelets in my blood, while something in my body is also prematurely destroying my skeletal muscle cells, a double whammy for me. As you can imagine, I am really a mortality number waiting to happen if I have a bad fall. The presence of a second or third additional medical condition might result in the increase as high as a 7-fold higher mortality risk compared to the same age group without IBM. So what can we do to increase our lifespan with IBM? Number 1, to fight the number of contributors of IBM-caused mortality, pay close attention to what your swallowing muscles are telling you. Visit a specialist when you start noticing problems swallowing or choking when consuming food or drink, or at least learn some exercises that may strengthen the muscles in your throat. Secondly, stay mobile, but do what you have to do to keep from falling, even if it slams your pride to accept the use of a power chair. Accepting that power chair earlier rather than just a tad too late could add years onto your life. Thirdly, if you are comorbid, analyze the conditions together. Realize how the negatives of one might affect the other. Make sure all your specialized physicians are aware of your conditions and demand they discuss your case with all of your other specialists to make a team of doctors analyzing your case, rather than all thinking only about their individual specialties. Order some myositis booklets from the Myositis Association and take 2 along to your doctor visits. One for your doctor and the second one for that intern that might be shadowing your doctor during your appointment. Believe me, interns and physician assistants appreciate the reading material, and IBM and myositis are 2 great subjects for their awareness. Number 5. Buy items for yourself and for your living space that promote your safety and might keep you off the serious fall list. Make home modifications early so you can better cope with your IBM. Purchase that power chair to prevent that serious fall, not after. Keep active, but remember not to overdo it. Having IBM probably means that overdoing your exercise routine could damage muscles, making them easy prey for your immune system to prematurely destroy. The results of this study highlight that there is a recognized need to manage the consequences of IBM, primarily severe dysphagia and injuries due to falls, in order to reduce their potential contribution to premature mortalities. It is the job of researchers and scientists to come up with the real means to curb IBM morbidity, but it's up to us IBMers to help curb secondary consequences that might affect our own mortality rate. Well, this wasn't the most satisfying subject to cover in a video, but I believe in the case methodology, explaining things in clear and simple English for my viewers. Please click the thumbs up if you like these IBM myositis videos, and subscribe below if you already haven't done so. Feel free to email me with any future video topics of how I cope with my inclusion body myositis. Thanks for watching. Stay strong, my friends.